Welcome to County Connection, where we talk about events, programs, and services offered by Summit County government. We have a great show lined up for this February episode. We're going to be talking about mental health priorities for Summit County, free counseling services available for local veterans, and new workforce housing units coming online in the Keystone area. Thanks for joining us. For this first segment of our February episode, we are going to be talking about the mental health priority within our Community Health Improvement Plan. And here to shed light on this topic is Amy WINELAND, our Public Health Director at Summit County, CASSIE COMEAU from the Community Care Clinic, and Katie Schmidt, also from the Care Clinic. Welcome, ladies.
Thank you. Glad to be here.
All right, so Amy, the Public Health Department, in partnership with a lot of other organizations in Summit County, completed a community health needs assessment in which you really looked at the health of our community and how we're doing. And then you took all that information and then created this incredibly robust health plan to address what you found in those in the needs assessment. And
Right.
So tell us a little bit more about that process and where we are right now.
Sure. So it occurred in actually began in 2017 and into 2018 was the assessment, and then the plan started being implemented actually in 2018 of the fall of last year. And it encompassed over 30 agencies and community partners that helped develop the assessment as well as the plan. And then we have many partners who are lead agencies on the various priorities that we have. 3 priorities came out of that process. One was mental health for families that we're going to talk about today, opioids and substance use, specifically around opioid prevention. And then our third priority was the determinants of health and health equity.
Right. Okay. So we have had some conversations about other pieces of the plan, and today we're going to focus on mental health specifically for families. And so what did you find in the assessment that spoke to this need in the community?
Sure. So the assessment found that we have a lot of our residents that are either struggling with or know somebody who's struggling with behavioral health challenges. And we found that 21% of our residents reported that they themselves have depression or anxiety. 66% know someone who is struggling with mental health or substance use. We have a suicide rate that's 3 times the national average. 1 in 4 of our high school students report being sad or hopeless for almost every day for more than 2 weeks at a time. We also found that only 60% of those who need treatment are actually getting the treatment they need. The good news is that those who get it feel that it has helped. And overall, the public feels that we haven't done enough to address this issue in our community.
So then that naturally leads to the question, what will we do to address this priority?
Sure. A diagnosis of mental illness in one family member really affects the whole family. And so an ideal approach is to really take the family in mind, keep the family in mind, and to empower the family to build off strengths that already exist and foster new skills. And so keeping families in mind, the overall goal for the plan for this priority is to really enhance the continuum of services and resources available to address varying needs of behavioral health illness in our community. Yeah.
Great. So Cassie, one of the strategies to address this priority is to work specifically with adolescents. Can you tell us about what's envisioned there?
Yeah, so the data that Amy talked about supported kind of a long-term idea that we had with a few different community partners around creating a bit of a higher level of care for adolescents who have mental health related issues and concerns, and their families, like Amy was alluding to. We've been doing behavioral health care in Summit County for a long time with youth, from kindergarten through high school, and we really realized that when families weren't as much of a part of a treatment as we wanted them to be or they needed to be, that the outcomes weren't occurring as quickly or as robustly as we would want them to happen. So when we thought about creating a step up kind of middle level treatment for adolescents, we knew we needed to get families involved as well. And we know that can be difficult for families, but we knew that for a higher level of intensity for treatment, families had to be a part of it. And so what we had long talked about was an idea that's starting to occur in college campuses, other kind of large like school-based settings, and this sort of spawned out of school-based health center talks with administration in the school district and then the school-based health center clinical providers. And we decided we wanted to have more of an intensive outpatient kind of program for adolescents and their families. And as we looked into that, we kind of modeled our program development off of something that Colorado State was doing. They were using a comprehensive DBT program model, which integrates a really skill-based, evidence-based therapy treatment model, comes out of a cognitive behavioral therapy approach. And we wanted to use that modality because of the evidence base and because it has a component for families and family group, family skills group. It's actually called multi-family skills group. So we began kind of program development using the comprehensive DBT model to formulate this middle of the road treatment for kind of higher risk adolescents and their families.
And can you define DBT?
Yeah, sorry. Yeah,
That's
it's
okay.
so common to us that we think everybody knows it. It's a really cool name. It stands for dialectical behavioral therapy. And like I said, it's kind of under the umbrella of cognitive behavioral therapies. They sometimes call them these third waves, which is fun to think about. And it's a really nice fusion of some kind of cognitive behavioral strategies. It has a mindfulness component. It has a little bit of, or a lot, about emotional regulation and emotional tolerance, distress tolerance, and also interpersonal effectiveness. So it kind of is broken into a few very specific modules. And not only do the individual adolescents get those kind of skills and approaches in therapy, their families are getting them as well in the weekly family skills group.
Great. And so in looking at this more intensive approach, what's the timeline for implementation?
So we actually received a fairly large grant in the spring, which allowed us to train 6 of our people on our team, about 150 training hours in May, and then again we returned in December to get feedback on our program. So in between that time we developed the program and we started our first cohort. So we've now been through that first cohort and we're on to our second.
Excellent. And so if people are interested in learning more about these programs that will be part of the mental health priority, and or just about the community health improvement plan in general, where can they go about finding this information?
Yeah, it's all on our public health website. The assessment as well as the plan and all the strategies are laid out in the plan for the next 5 years, actually.
Okay, great. And then if folks are interested, either adults or kids interested in accessing some of the mental health services that the Care Clinic offers, how can they go about finding you and looking into those services?
Great. So Care Clinic has a website, summitclinic.org. They can also just call the main clinic line, 668-4040. And from there, they'll be able to kind of access any of the services, behavioral health, comprehensive DBT, any of the services that we have for adolescents, kids, adults, families, couples. So those are the easiest ways.
All right, fantastic. Well, thanks so much to all of you for the hard work that you've put into this really important issue for our community.
Thank you.
Thanks, Julie.
Thanks for having us.
Absolutely. All right, stick with us. We're going to take a quick break, and when we come back, we're going to talk about services for local veterans in Summit County.